Hello, I'm Dr. Jessica Clemens. As a physician who has worked with thousands of patients struggling with type 2 diabetes, I've come to realize something crucial. Many people focus entirely on blood sugar numbers, medications, and carbs, but there's a deeper layer we often miss. Behind the scenes, your body depends on a delicate balance of minerals to function properly. These aren't just random trace elements. They're the building blocks of how your cells use insulin, how your nerves communicate, how your organs detox, and how your energy flows. Today, I want to share with you the top 5 minerals that every person with diabetes needs to know about. If you're low in even one of these, your blood sugar may be harder to control, your nerves may feel weaker, and your kidneys or heart could be under more stress than you realize. But here's the good news. Correcting these deficiencies doesn't require anything extreme. It just takes knowledge and smart choices. So let's explore these powerful minerals one by one and uncover how they quietly but powerfully shape your journey with diabetes. Let's begin with the first, molybdenum. Part 1, molybdenum. Let's start with a mineral that's often overlooked but absolutely essential, molybdenum. It may not get the spotlight like magnesium or calcium, but without molybdenum, your body cannot effectively eliminate toxins, balance metabolism, or protect itself from internal damage. Now, why does this matter for people with diabetes? When you have diabetes, your cells are under constant oxidative stress. Elevated blood sugar increases the production of harmful compounds known as free radicals, tiny molecular troublemakers that damage tissues, accelerate aging, and impair organ function. Your body relies on a powerful detox system to neutralize those free radicals, and molybdenum is a key part of that defense. Molybdenum helps activate important enzymes like sulfite oxidase and aldehyde oxidase, which support your liver's detoxification processes. This means molybdenum is working behind the scenes to remove toxins, metabolize drugs, and break down harmful byproducts in your bloodstream. If your body can't clear these toxins efficiently, your insulin resistance can worsen, your energy can drop, and inflammation can spread. But molybdenum's role doesn't stop at detox. It also helps your body process sulfur-containing amino acids, such as methionine and cysteine. These are critical for maintaining healthy blood vessels, especially in people with diabetes who are more vulnerable to cardiovascular issues. When these pathways are supported, your blood flows better, your heart works more efficiently, and your cells stay nourished. So, how do you know if you're getting enough molybdenum? The truth is, many people don't, even though it's needed only in trace amounts. Low molybdenum levels can be caused by processed diets, poor soil quality in the foods you eat, or kidney conditions that affect mineral absorption. Early signs of deficiency might not scream for attention, but they include brain fog, fatigue, joint pain, and even worsening blood sugar regulation. Thankfully, it's not hard to boost your intake naturally. Molybdenum is found in several whole foods, including legumes like lentils, black beans, and chickpeas, whole grains such as oats, barley, and buckwheat, nuts and seeds, especially almonds and sunflower seeds, dark leafy greens including kale and spinach. Even small servings of these foods a few times per week can help restore your molybdenum stores and support the enzymes that detox your body day and night. If you're considering supplements, be cautious, because molybdenum is needed in very small amounts. Taking too much can cause side effects, such as gout-like symptoms or copper imbalances. I always recommend starting with food first, then testing your levels with your doctor before supplementing. In my clinical experience, when patients begin eating more molybdenum-rich foods, they often notice more than just better blood sugar. They feel sharper, clearer, and more energized. Their digestion improves. They sleep better. That's because detox pathways affect everything from mental clarity to immune health, and molybdenum is a silent driver of those systems. In short, molybdenum is like the maintenance crew of your metabolism. You don't see it working, but without it, waste builds up, systems slow down, and your body struggles to keep up. For people with diabetes, giving this mineral the attention it deserves can be a quiet but powerful game changer. Now that we've covered molybdenum, let's shift our focus to another mineral that plays a direct role in insulin function and blood sugar regulation. It's one of the unsung heroes in metabolic health, especially for those fighting insulin resistance. Let's talk about vanadium. Part 2. Vanadium. Let's move on to vanadium, a mineral that isn't often talked about but quietly mimics one of the most important hormones in your body, insulin. Yes, you heard that right. Vanadium has the remarkable ability to imitate insulin's function at the cellular level. For people living with type 2 diabetes, where insulin resistance is a daily struggle, this trace mineral offers a natural way to help lower blood sugar levels and support better glucose control. Let's break this down. In a healthy body, insulin acts like a key. It unlocks the doors of your cells, allowing glucose to enter and be used for energy. But in type 2 diabetes, those doors become resistant. Insulin's key doesn't fit as well, so glucose builds up in the blood, leading to fatigue, inflammation, and long-term complications. This is where vanadium comes in. It supports enzymes that enhance glucose uptake into cells, even when insulin is not working efficiently. In animal and human studies, vanadium compounds have been shown to reduce blood glucose levels, improve insulin sensitivity, and even assist in lipid metabolism, which helps with cholesterol and weight control. Of course, vanadium isn't a magic pill. It's not a substitute for medication or lifestyle change. But as part of a whole food, nutrient-rich diet, it can be a gentle partner in your body's effort to restore balance. You might be wondering, where does vanadium come from? Interestingly, this mineral is found in small amounts in many plant-based foods, including mushrooms, especially shiitake, shellfish, such as oysters and crab, whole grains, including oats and brown rice, black pepper, parsley, and dill. It's also present in drinking water in trace amounts, depending on your region's soil and filtration systems. While it may not be as abundant as other minerals, every bite of vanadium-rich food helps activate glucose-regulating enzymes that support your daily metabolic function. Let me offer a word of caution. While vanadium has shown impressive results in some studies, high doses in supplement form can be toxic. It's true that researchers have used vanadium supplements to test blood sugar lowering effects, but these were carefully controlled and short-term. Long-term use of vanadium supplements may affect liver or kidney function if not monitored by a healthcare provider. That's why, as a doctor, I strongly advise focusing on natural food sources first. They're safe, balanced, and provide vanadium in combination with other vital nutrients like fiber, antioxidants, and magnesium, all of which play roles in metabolic health. Here's a simple meal idea. Sauté mushrooms with parsley and garlic and olive oil, serve over quinoa, and top with a sprinkle of black pepper. It's flavorful, full of plant-based minerals, and supports your blood sugar in a meaningful way. What I love most about vanadium is that it works quietly, steadily, and in the background. You won't feel it instantly, but over time, people often notice they're less fatigued after meals. Their sugar doesn't spike as sharply, and their energy becomes more consistent. That's the power of nutritional balance, not overnight miracles, but deep, sustainable healing. As we continue our journey through these 5 essential minerals, our next stop is selenium. This one is a protector, especially for your pancreas, your heart, and even your immune system. Let's explore how selenium helps stabilize your health from the inside out. Part 3. Selenium. Now let's talk about selenium, a powerful trace mineral that acts like a bodyguard inside your cells. It may be tiny in amount, but its role in protecting your health, especially if you're living with diabetes, is massive. Selenium is best known as a strong antioxidant. It helps your body fight off oxidative stress, which is elevated in people with high blood sugar. When glucose levels are too high, free radicals are generated. These are unstable molecules that can damage your cells, blood vessels, and even your organs over time. Selenium neutralizes those free radicals before they cause serious harm. But the magic of selenium doesn't stop there. It also plays a key role in supporting your thyroid gland, which controls your metabolism. Why is this important for people with diabetes? Because when your thyroid slows down, your metabolism slows too. That means more weight gain, more fatigue, and greater difficulty managing blood sugar levels. In fact, studies have shown that people with type 2 diabetes often have lower selenium levels, and low selenium is linked to increased insulin resistance, higher inflammation markers, and impaired immune response. Your body is constantly repairing itself, and selenium is part of the repair crew, especially in sensitive areas like the pancreas, which produces insulin. So how do you get selenium? Thankfully, it's present in several easy-to-find foods. Brazil nuts are by far the richest source. Just 1 or 2 per day is enough to meet your selenium needs. Seafood, especially tuna, sardines, and shrimp. Eggs, particularly the yolks. Sunflower seeds. Whole grains, such as brown rice and oats. A word of warning here. While selenium is essential, too much can be harmful. This is why I never recommend high-dose selenium supplements unless prescribed. Symptoms of excess include brittle hair and nails, skin rashes, and even nerve damage in extreme cases. Stick to food sources, and you'll stay safely within the healthy range. One of the most powerful aspects of selenium is its ability to strengthen your immune system. For people with diabetes, a compromised immune response is a serious concern. Even small infections can take longer to heal and raise blood sugar levels. Selenium helps the immune system mount a faster, more balanced defense and recover more quickly. I've had patients who, after adding selenium-rich foods to their diet, report better energy, sharper mental clarity, and fewer seasonal colds. It's not flashy. It's not trendy, but it works quietly and consistently where it matters most, inside your cells. Here's a simple selenium-boosting snack I love to recommend. A handful of sunflower seeds with a boiled egg, or a smoothie with oats, Brazil nut milk, and a touch of cinnamon. Simple, nourishing, and supportive of both your immune and metabolic health. Selenium reminds us that healing isn't always about doing more. Sometimes it's about giving your body the right materials to repair itself, little by little, day by day. Do I eat? Now, we'll turn to a mineral that works directly with insulin, improving how your body processes sugar and helping your cells regain sensitivity. This one is vital for anyone who feels tired after meals or battles, sugar crashes. Up next, chromium. Part 4, Chromium now. Let's shine the spotlight on chromium, a mineral that may be small in size, but plays a huge role in how your body processes sugar. If you're living with diabetes or even pre-diabetes, chromium is one mineral you absolutely want working on your side. Chromium's most important function is helping insulin do its job. Think of insulin as the key that unlocks your cells so glucose can enter and be used for energy. Chromium acts like the assistant to that key, making sure the lock turns smoothly. Without enough chromium, even if your body makes insulin, your cells may not respond to it properly. This is known as insulin resistance, the hallmark of type 2 diabetes. It's one of the reasons blood sugar stays high, even when you're taking medication or watching your diet. But with the right level of chromium, your insulin sensitivity improves. That means your body can move sugar out of the bloodstream faster, reducing spikes and making you feel more stable throughout the day. Several studies have shown that chromium supplementation can help reduce fasting blood glucose, improve cholesterol levels, and even decrease cravings, especially for sugar and carbs. This is powerful for people trying to make better food choices because chromium naturally supports appetite control. So, where do you get chromium? You'll find it in several everyday foods, such as broccoli, one of the richest sources, grapes, apples, and oranges. Whole grains, especially bran cereals and brown rice. Nuts and seeds, like almonds and sunflower seeds. Green beans and potatoes. The catch is that modern farming practices and food processing strip much of the natural chromium from our diets. That means even people eating well may still fall short. Age can also reduce how efficiently the body absorbs chromium, making deficiency more common in adults over 50. Should you take a supplement? Possibly, but cautiously. Chromium is generally safe in low doses, but too much can interfere with iron and zinc absorption and may affect kidney function if taken long-term without monitoring. If you're considering supplementation, start with diet first. Then talk to your doctor about testing your levels before adding a pill. What I find fascinating about chromium is how quickly some patients respond to it. I've had people tell me that within a week of eating more chromium-rich foods, their afternoon sugar crashes disappeared, they had fewer carb cravings, and their mood felt more even. That's not a coincidence. Your brain and your blood sugar are deeply connected, and chromium helps keep both balanced. Here's a meal idea I often share: sautéed broccoli with garlic, a side of brown rice, and roasted almonds. It's simple, nourishing, and packed with chromium. Or snack on apple slices with sunflower seed butter. These small choices, repeated regularly, create powerful change. Chromium is not a cure, but it's part of the support system your body needs to function better, especially when dealing with chronic blood sugar issues. By restoring chromium levels, you help your insulin become more effective, your energy more consistent, and your cravings more manageable. And now, let's turn to one final mineral that's a true cornerstone of metabolic health: magnesium. If you've ever dealt with muscle cramps, fatigue, or poor sleep, you may already be familiar with it. But for people with diabetes, magnesium has even more important jobs to do. Let's take a closer look. Part 5. Magnesium. Finally, we arrive at one of the most critical minerals for people living with diabetes: magnesium. If I had to choose one mineral that nearly every patient with type 2 diabetes should pay attention to, this would be it. Why? Because magnesium is involved in over 300 biochemical reactions in the body, and many of them directly impact your blood sugar, insulin sensitivity, and nerve health. Let's begin with the basics. Magnesium helps your body regulate glucose and produce insulin. When magnesium levels are low, insulin can't function properly, and your cells become more resistant. That leads to higher blood sugar, increased inflammation, and a greater risk of complications like nerve damage, heart disease, and even depression. Unfortunately, magnesium deficiency is extremely common among people with diabetes. In fact, research shows that up to 75% of adults with type 2 diabetes have low magnesium levels. This happens for several reasons. First, high blood sugar causes the kidneys to flush out more magnesium through urine. Second, common medications, like diuretics or proton pump inhibitors, can interfere with absorption. And third, many of us simply don't eat enough magnesium-rich foods. So how can you tell if your body is running low on magnesium? Some of the early signs include muscle cramps or spasms, especially at night, fatigue and low energy, constipation, trouble sleeping or waking up feeling unrefreshed, tingling or numbness in hands and feet. If these sound familiar, your body might be calling for help. The good news is restoring magnesium doesn't require a prescription. You can begin with food. Magnesium is found in a variety of delicious, everyday foods. Dark leafy greens like spinach and Swiss chard, nuts and seeds, especially almonds, pumpkin seeds, and cashews. Legumes like black beans, lentils, and chickpeas. Whole grains, including brown rice and quinoa. Avocados, bananas, and even dark chocolate. Incorporating these into your meals isn't just nourishing, it's protective. Magnesium helps your body maintain a healthy blood pressure, regulate heart rhythm, reduce inflammation, and improve sleep quality. It also supports your nervous system, which is essential for preventing diabetic neuropathy, a painful and often irreversible nerve condition. Some people also benefit from magnesium supplements, especially if their levels are significantly low. But like all supplements, dosage matters. Too much magnesium can cause diarrhea or interact with certain medications, especially in people with kidney issues. Always check with your doctor before starting supplements. One of my favorite things about magnesium is how quickly the body responds once it's replenished. I've seen patients go from restless nights and cramping legs to calm sleep and better blood sugar readings in just a few weeks of adding magnesium-rich foods. It's not magic. It's the body finally getting what it's been missing. Here's a simple magnesium-boosting idea. A quinoa salad with black beans, spinach, avocado, and pumpkin seeds, dressed in olive oil and lemon. It's nutrient-dense, easy to prepare, and deeply satisfying. Magnesium gives your body the stability and strength it needs to manage stress, maintain glucose control, and protect your nerves and heart. When magnesium is present, everything works more smoothly, from your muscles to your mind. Now that we've explored all 5 essential minerals, let's bring everything together in a final reflection. I'll leave you with a few key takeaways and practical steps to help you live stronger, more balanced, and more confident in your health journey. Let's move to the conclusion. Part 6, Conclusion. Now that we've walked through the 5 essential minerals, molybdenum, vanadium, selenium, chromium, and magnesium, I hope you're beginning to see just how powerful nutrition can be in supporting your journey with diabetes. These minerals are more than numbers on a label. They are foundational building blocks that help your body process insulin, regulate blood sugar, detoxify waste, protect nerves, and support a healthy heart and metabolism. And while medications and exercise are important, your body also needs raw materials to do its job well. If you're living with diabetes, pre-diabetes, or supporting someone who is, the key takeaway is this. Your plate can become your most powerful medicine. You don't need to overhaul your diet overnight. Start small. Add in magnesium-rich spinach to your dinner. Snack on sunflower seeds or almonds. Try salmon with broccoli. These little changes, when done consistently, can lead to better energy, fewer blood sugar crashes, improved sleep, and long-term protection against complications. If you found this video helpful, please give it a like and let me know in the comments. Which mineral surprised you the most? Don't forget to subscribe and turn on notifications so you never miss a video that could improve your health. Stay informed, stay balanced, and I'll see you in the next one. Dr. Jessica Clemens.